General guidance. iBreeze series PAP system is a completed portfolio of your daily assistant, which includes main unit, carry bag, power supply adapter, tube, mask, screen cushion, air outlet connector, SD card, air filter, quick operation manual, user manual, packing list. iBreeze series PAP system includes CPAP system and BPAP system with 5-inch touching display. For CPAP system, particular design version for women is available. Connect the air outlet connector with main unit. Get the adapter and power supply connected. Connect the tube. Wear the mask comfortably. Mask fit function on ventilator can be used to offer corresponding help on it. Connect the mask with tube. Click the on/off button, start ventilation. You could adjust the mask once again while lying down. Click the on/off button again to stop after therapy. For BPAP modes, click and hold for 3 seconds to stop. Guide of humidifier. Take out the water chamber. Open the cover and fill water. Water should not exceed the max mark. Seal the cover, wipe the water, and dock the chamber into the main unit. Water chamber should be emptied after use. Please be cautious for the heating pad's high temperature. Inclining the machine is prohibited while water chamber filled with water. Guide a wireless pulse oximeter. Make sure a Bluetooth module is available on your machine. Enable the Bluetooth function. Wear the watch properly. Switch on the watch. During ventilation, in 10 seconds time, SpO2 and pulse rate will be reflected on display. A continuous spot check result of SpO2 and pulse rate will be recorded in patient's report. Introduction of UI. Patient's interface. In standby mode, users can check the therapy summary, set the humidifier, test the mask fit, process comfortableness related setting, process the system setting, and check the alarm and alert record. A waveform interface is also available on PAP machine. In standby mode, click and hold the navigation knob and ramp simultaneously for 3 seconds to enter or come out the clinician's mode. In clinician's mode, ventilation modes, therapeutic parameter setting can be conducted. Viewing the therapeutic result. There are 4 ways to view the therapeutic result. 1. View the summary report on main unit. 2. Export data from SD card. View the detailed analysis on computer with help of iMatrix PC software. 3. Access cloud-based data server on Explorer. 4. View the data on APP on your smart terminal, such as smartphone and pad. Maintenance. Open the air inlet magnetic cover. Take out the old filter. Put the new one and settle it properly. Mask cleaning. Mask and headgear should be cleaned separately. Hook and loop should be fixed while cleaning.